Okay, so it does look like we have a patient arriving as the clinic is about to close. Whatever, as long as we're gonna make sure that they're okay. And it looks like they bumped their forehead doing something. I'll have to ask them about it. It's always people falling asleep and rolling off the bed. That's always what happens. And then they have some tummy problems. I'll have to ask them about that too. Okay, so I'm gonna have the front desk send them on in. Let's make sure that I have everything ready here. Perfect, perfect. All my tools are here. Perfect. And the information's being sent to my computer now about their primary results. Okay. And perfect timing. Hello there. Are you here for the exam? Perfect. I am Nurse TMI. Pleasure to meet you. Please take a seat right at that medical chair in front of me, okay? Yes, good, good, good. And what does TMI stand for? Oh, too much information. You'll find out really soon why. Yes, exactly. And you are coming in quite late to the clinic. How are you feeling? Yeah, I can tell you look a little bit dizzy, a little bit tired, okay? So just please take a seat right at the little medical chair. I just changed out the pillows so that they are extra soft and floofy. And I heard that you're having some tummy problems. I'm gonna let you know now, nothing embarrasses me. I've seen everything on earth. Yeah, and when I mean that, I do in every way, shape, and form. Good, okay. So if you need to relax, lay down. If you need to flatulate, you can. No one's gonna stop you here, and I won't be embarrassed. I might mention it, but I won't be embarrassed. Good, 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 good. Just making you feel safe. So I was looking at your chart here, and it does look like you said you bumped your forehead at some point. Yeah, and it does look like your tummy hurts. Would you care to explain first what happened to your forehead, and may I touch it? Okay, good. I'm just gonna carefully touch your forehead right there, okay? Where I do see a bump. Yeah. Okay, so what happened? Oh, okay, so you were watching anime. Okay, and you fell asleep and rolled right off your bed. I could tell by the anime shirt that you were wearing. Yeah, what is that? Is that what anime? Oh, see, I don't watch that, but I understand. It's cute, it's cute, it's cute. And so, you were watching anime, rolled off the bed, and fell over. Okay, and when did the stomach problems end up happening afterwards? Have you had this constantly, or when did you start experiencing it? Okay, so a bit recently, and what would you say is you're experiencing? Okay, so a bit of just aches and pains. Okay, well, we'll check that out. Any changes in your diet? Well, I don't want to shock you here, but I did see your weight on the scale, and it is a bit different than last time. Yeah, it really is. Do you want to talk about that at all? No? Okay. Well, I'll mention other things then, okay? Good. So, what we're going to do is we're going to do something called a head-to-toe exam, and I'm only going to just take a look at everywhere that seems to be the affected areas, okay? So, first what I'm going to do is I'm going to take your temperature, okay? So sit still. Have you felt any, like, cold or flu symptoms in the past 2 weeks? Perhaps you've been, like, watching a lot of TV at night. You seem like the type, and you haven't been getting as much sleep as you should have. Yeah, well, I can tell that you may not be telling the full truth. You do have a lot of luggage under your eyes, which tells me the true story. Okay, you can be honest with me. You can be honest with me. I'm just like you. I'm just like you. Okay. And I do hear your tummy going a bit crazy. It does sound like someone is using a lawnmower. Yeah. So if you need to flatulate, you can. I won't be embarrassed. Okay, good. So let's just take your temperature first. Just sit still for me. Okay, 3, 2, 1. Okay, looks like your temperature is exactly where it should be. Perfect. Let's write that down. And what I'm going to do next is I'm carefully going to take a look just inside your eyes, okay? Good. So we always test this little functionality, and we're just going to make sure that your eyes and your head was not affected by the bump on your forehead first, okay? So I'm going to ask you just to stare at the light carefully. 3, 2, 1. Do you see the light? Good. And then the other eye. 3, 2, 1. Good. Okay. And can you look at me? Your eyes do appear to be just a slight bit irritated. Do you have allergies? Or perhaps you're someone, again, who stays up, like, really late and, like, you watch a lot of television? Yeah. And I'm going to ask see for you that you do. And I'm gonna tell you right now, cut using your phone so much. Okay, good. You do seem like the internet type though. Yeah, you do. Yeah, you do. You do kind of seem like a Discord moderator type of person. Yeah, my kids tell me all about that. Yeah. I'm gonna write that down. And have you had any problems with your eyesight in the past like 2 weeks or so? Or do you feel like since you bumped your head, you feel like your eyesight has been a bit different? Okay, well, we'll check your eyes just in case, okay? First, I'm going to do something, it's called a visual field test. I'm just going to test your eyes, okay? So with my hand that has a glove and with my hand that has without, I'm going to ask you which hand is moving, my left or my right, okay? Good. So just lift your hand, whichever hand I'm moving. Okay, ready? Let's go. Good. 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 Great. Looks like your eyes are doing phenomenal. Kind of surprising. I bet you play a lot of video games, do you? Yeah, you do. Yeah, you do. I can tell. No judgment, but full judgment. It's not good for your brain or your eyes to be looking at a screen that much. Do you wear any blue light reflective glasses or anything like that? No, I'm going to give you this top pair just before you go, okay? I'm just going to write that down. Now what I'm going to do is I'm going to test your eye visual field, okay? I'm going to ask you just to follow the light, and because you do seem like a gamer or someone who watches a lot of YouTube, you're going to be great at this. I can tell. Just don't move your head and just follow the light with your eyes, okay? Good. So, just follow it. Good. Looking up. Good. Follow the light. Looking down. Good. Okay, looking over here in the center. Good. And can you look back at me? Amazing. Can you look back at the light? Good. Can you look back at me? Can you look back at the light? Look back at me. Look back at the light. Good. Now I'm going to ask you, keep following the light with just your eyes. Good. Follow the light with just your eyes. Good. Great. Good. Fantastic. Marvelous. Now can you look back at me? Good. Now I'm going to get just a bit close to you. And I'm just going to take a look inside each eye. And I'm going to take a quick look. Can you look directly at the light? Good. And can you look back at the wall? Okay. Other side. Can you look at the light? Good. And can you look at the wall? Very good. Perfect. Thank you so much. You can relax your eyes now. That just means your eyes are working well. Okay, I'm just going to write this down. Good results here. So next we're going to do a pressure system test. What I'm going to do is I'm going to put a little bit of pressure on your abdomen and your thorax. And this is just to assess your stomach, okay? And just a couple of questions before I do assess that. What is your food and nutrition intake like? Like, what is your daily, diet like? Oh, great heavens. Oh, so it's like a lot of processed foods. And, okay. And are you a fan of perhaps fast food restaurants, such as we do have McDonald's, perhaps something along the lines of like a Taco Bell? Perhaps you're a really big fan of Tim Hortons. Maybe you really enjoy Wendy's. What do you like to consume? I'm just writing this down. No judgment again, but full judgment. Okay, and what have you been eating recently? Okay. And quick question. How often, when you do go to the bathroom, how often are we talking that you are able to do what we like to call number 2 per week? Barely once. Excuse me. Okay, so what we're going to do is I'm going to write you something kind of like an easy type of increase of fiber in your diet. I'm going to provide you something that's like a fiber supplement. You're going to mix it with some water and you're going to drink it. Do you drink water? Your skin's kind of dry, I could tell. also how much water we're going to drink is about 70 to 80 ounces of water a day. And you kind of seem like you don't consume that much water. Is that true? Yeah, I can tell. I'm writing that down. Okay. Now I'm just going to go put a little bit of pressure on your stomach. Let me know if it bothers you, okay? So first I'm going to start right there on the shoulders, okay? Just put a little bit of pressure. 3, 2, 1. Any pressure? Good. You're good. Feeling good. Great. Now right below the sternum. Good. Just a little bit of pressure. 3, 2, 1. Okay. Any pressure? Just a little bit. Okay. Now we're just going to put a bit of pressure in the center of the thorax. That is just about a couple millimeters above the navel. Good. Here we go. 3, 2, 1. And any pressure? Yes, I can tell. That one I could easily tell. I'm going to quickly just test right there. These are called your lymph nodes. And what I'm going to do is I'm going to put a bit of pressure right underneath your chin, okay? You let me know if you feel anything, okay? Good. So 3, 2, 1, just a bit of pressure. And does that feel okay to you? Okay, good. Relax. Good. Now I'm going to ask you, can you lift your arms like this? I'm going to put a bit of pressure right below your arm, okay? 3, 2, 1. Okay, and relax. So what I was checking for was a bit of water retention, and that's typically caused by diet or consuming a lot of salt, which I can tell you do. I'm gonna write that down. We're gonna increase the amount of water that we get in a day, the amount of fiber that we get in a day, so that you can feel better and that your tummy feels amazing, and that you can also, what we like to call, hydrate yourself. Yeah, ever heard of that? Crazy, right? Yep, I'm gonna write that down. So, next what I'm going to do is I'm going to put something on your finger, and this tool is quite phenomenal. It's going to get your heart rate without putting a lot of stress like a stethoscope on, and it's going to get your blood pressure, okay? So I'm just going to ask if you can give me your finger. Good, I'm just going to put that right on your finger. You're going to hold for a couple of seconds, okay? So just relax, think of amazing things. So think of something relaxing, maybe your favorite level in a video game, because you seem like that type, right? Yeah. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Let's check. So it looks like your oxygen level is amazing, 99%. That's fabulous. And your beats per minute, which is your heartbeats per minute, is at around an 87, which is perfect. That is exactly what we're looking for. Good. So I'm glad that that's actually perfect. That's something that we actually like to take a very good close look at, because if you're having any problems with your breathing or perhaps with your heart rate, we'd like to double check that and make sure that it's not something else, okay? Good. I'm just gonna write that down. Okay, next what I'm going to ask you to do is I'm going to just check inside your mouth, okay? And especially if you said you bumped your head, sometimes if you do fall or roll over a little too hard, you can manipulate a little bit of your jaw a little bit, or sometimes you can damage your teeth, okay? So what I'm going to do is I'm just going to check inside your mouth, okay? Good. Now just say ah. Good. Maybe don't say ah too much, because I do kind of, I sense some dragon breath going on. How often do you brush your teeth? How often do you floss? I'll be able to tell if you don't tell me the truth. Good, good, good. Okay, so just say ah. Good. So it does look like you have teeth. Congratulations. That's awesome. Good. And gonna check the side of your teeth to see if you accidentally just manipulated your teeth a little bit, okay? And relax. Perfect. You can close your mouth now. And do you feel like you have any sensitivity with your jawline or your teeth? No? That's fabulous. That's super good. So I'm going to write that down. And I'm also going to write down that you need a new toothpaste, and I'm going to send you home with a new toothbrush. Yeah. Oh, no. It's on the house. Yeah. Trust me. It's on the house. Okay. Next up, what I'm going to do is we're going to do something that's a very quick exam. It's called a cranial nerve exam. And if someone has ever bumped their head, I always like to test this to make sure that you're functioning well with all of your cranial nerves, because sometimes it can be a bit changed if you just bumped your head even up here, because sometimes it can change the way that your muscles work, okay? So we're going to do something. We're just going to get distracted. Good, follow the finger. Good, 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 good. Don't get distracted. Perfect. Relax, relax, relax your eyes, relax your eyes. Good. Now we're going to do a muscle test with your face. I'm going to ask you to carefully raise your eyebrows as if you were very shocked. Maybe you saw something really intense in an anime. Just shocked. Good, good, good. Just raise your eyebrows. Wow, good. I'm going to put a bit of pressure right here. 3, 2, 1. Okay, and relax. Amazing. That's flawless. Now I'm going to ask you with your eyes. Can you close your eyes very tight as if you were trying to close your eyes from the sun? Yes. So just close your eyes very tight, and I'm going to put a little bit of pressure on your eyes, okay? Good. 3, 2, 1. Close your eyes. Good, 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 good. Perfect. And relax your eyes and look back at me. Good. Looks like your eyes are functioning well. Can you close one eye? Good. And can you close the other eye? Good. Now can you close both eyes at once? Good. And can you open both eyes at once? Perfect. Looks like your eyes are functioning well. Now I'm going to test your nose. I'm going to put just a little bit of pressure on your nose right here. Let me know if you feel it, okay? 3, 2, 1. Did you feel that? Perfect. Now with your mouth, can you give me a very comical smile, like in an anime? Good, because I know you'd know exactly about that. Yeah, yeah, yeah. And can you give me like a big frown like this? Good. And just give me a frown. Perfect. Now, are you able to raise one side of your mouth up like this? Good. And can you do that for me, or can you try? Good. And let's try the other side. Good. Perfect. Looks like you can manipulate your face well. That is actually good news, because the ability to move your face around means that all of your muscles in your face are working properly. So that's what we like to check for. Next, I'm going to check your nose, and I just have 2 or 3 essential oils here just to make sure that your sense of smell is working in coordination to your cranial nerves. Okay, so I have this first one here, and this one is actually called Sleep. However, it is not essential oil that is confusing. It is an essential oil that has a very distinct smell. What I want you to do is to try and isolate that smell and tell me exactly what it smells like, okay? So, just going to go with this. Tell me exactly what you smell with this essential oil. Amazing. So it's a bit floral. Good, good, good. And it's a bit like soap. Perfect. And what is it? Lavender. You got it. That was amazing. Good job. And speaking of soap, do you shower frequently? Just making sure. You know, sometimes we never know, especially when you walk in here with pajamas. You never know. Yeah. So this next one we have is called Breathe. And again, this one has a very distinct smell. I'm going to ask you just to try and identify to the best of your ability, okay? And just tell me what essential oil you think this is. Again, this one is phenomenal. Okay, here we go. And let me know exactly what you think this essential oil could be. Okay, it smells like peppermint. It smells like gum. So what do you think? It's mint. Perfect. This one is eucalyptus peppermint. It is a very minty smell that'll actually help your breathing sometimes if you have a bit of congestion. So that's perfect. And on to the last one. Now this one is exactly what it says, so I'm not going to show you the label, but I truly love this one. This one is very calming, and I would say it reminds me kind of like something that you'd like to eat. So let's try this. What do you think this essential oil smells like? Amazing. It smells like a bakery, and it smells kind of like, yes, exactly like a cake. So what do you think this is? Some sort of cake decoration or something? Perfect. This one is vanilla. You did amazing. So it does seem like your sense of smell is working in coordination to your cranial nerves. And we have one more test here. One more test here. So I have an oil here that I'm going to just carefully use. And it's either going to be sour, it's either going to be sweet, or it is going to be bitter. So have you ever tasted a lemon and tasted that sour? It'll taste like that. Have you ever had a piece of candy and it was very, very sweet? It'll either taste like that, or if you've ever had artichoke without it being properly cooked, it could taste exactly like that. Okay, so we're going to try right here with this one. I'm going to get just a little bit. I'm going to place it right on your tongue, okay? And I'm going to just ask you to say, ah. You could say, ah. I'm going to place it right there. saw your face react perfectly. Yeah, and so what is that? That is very sour, very good. It also is flavored mint, so you know it can remove a bit of the dragon breath that you got. Yeah. Perfect. So I'm gonna take this glove off now. It does seem like your head is working properly, which is perfect. What I'm going to do last is I'm actually just going to put a bit of pressure right there on the bump on your forehead with a clean cotton round here. And what I'm going to do is I'm just going to sanitize the area, okay? And I always use a very good cleansing solution for this. This has iodine in it, and it has a small bit of hydrogen peroxide in it to carefully clean the area, okay? And this won't hurt at all. So I'm just going to ask you to close your eyes and relax for a second while I just apply this right to the area, okay? Good. Just relax. Perfect. And can you look at me again? Good. Just a little bit more. Are you feeling okay? Good. Good. And can you look back at me? Perfect. So, what I'm going to give to you is I'm going to write a little list here of things that we're going to do for aftercare for your forehead and for your stomach, okay? The first thing I'm going to do is I'm going to send you home with fiber, a supplement, okay? And we can talk and discuss about food options afterwards, but the first thing we're going to need you to do is drink more water in your day because your skin is kind of dry. And I'm going to ask you to take more fiber supplements so that you can actually feel a bit less pressure in your stomach area. It's very good for you. Okay, so I want you to just read the back of the box when you actually end up getting it at the pharmacy later on. And please, every day. Good. And then what I'm going to do is I'm going to actually send you home with, we have these little ice packs that you can just put right there. You can pop them in the freezer. You can place it on your forehead. So every single day, at least twice a day, what I'd want you to do is lay down and just put the ice pack right on your forehead, right there in a small compression setting for at least 5 to 10 minutes every single day, okay? And that's just to reduce a bit of the swelling and to make sure that it heals properly, okay? Good. And what I'm also going to recommend is I'm going to send you home with a toothbrush and toothpaste. You know why. Good. And then I'm going to ask that you can just come back in about 7 to 2 weeks, maybe 7 days to 2 weeks, so that we can double check and make sure that everything is going well there, just in case something does happen, okay? Because your health is our top priority. The reason why I am so concerned always and sometimes make funny faces is literally because we care about you, and you deserve to feel 100 to 1,000% every day, ever. Good. So I'm just going to send you home with that again. I was Nurse TMI. It was a pleasure to meet you today. Again, take care of yourself. Make sure you're not holding your phone too much because I did see your pinky fingers. Make sure you're drinking enough water every single day, eating and consuming enough fiber. I'm going to also give you these blue light glasses that I said I was going to give you. Wear these before you use any cell phones or computers for a long period of time. Just pop them on and use them as you normally would. There's no prescription. It's just a blue light lens to protect your eyes. So here you go with that. And just walk down just right to the end of the hallway to the pharmacy to get your other items, okay? Good. Enjoy yourself now. And again, maybe cut it down a little bit on the anime and video games, okay? Maybe chill on the Netflix. Good.